After a really hard residency, I actually didn't start working in a health center. I started working for a private company doing workers' comp. But the health center asked me to come in 1 day a week, and I started doing 1 day a week. And I found that those Fridays were my most relaxed, most refreshing days. I felt like I was doing good. I was helping people. And I did this job for about a year, and I decided, you know what, I love my Fridays. Why am I doing this other job? And so I went full-time in the community health center, and I've loved it ever since.
I grew up on public assistance, and I wanted to serve the same kind of group, and the mission of the healthcare center was really important to me as far as being a safety net for underserved patients. And then it really grew into, I like variety at healthcare centers, especially ours. We have a huge variety of patient types, even different insurance types, and their needs are sometimes very complex, and I think that's really fun and challenging as a physician to be able to practice a wide variety of family medicine and really utilize my full skill set.
The patients, oh, I love my patients. Nowhere else can you work where the patients are so grateful, they're so respectful. I have patients that come in, they bring me cherries, they bring me hugs, they bring me presents from Mexico, and they're genuinely love their children, they love their families, they want what's best, they're the working poor. They are just the heart and soul, and it's so rewarding to help them.
I might answer it differently depending on where in my career you ask this question, but right now I think it's teamwork. The environment that I work in, everyone seems to want to pitch in, get new ideas started, try new things, and really collaborate. And it's all for the patient, and I think people being more involved in patient care besides just maybe checking them in or going down their list of medicines, but really digging in and really trying to change the patient's health as a team. It's really fun.
I had the grandma and the children and the great-grandchildren. I had this whole family. And the grandma passed away from COPD. And I loved her to pieces. And I was pregnant after this. And her family came in. One of the family members had a visit, and the entire family came in for that visit. And I thought it was a little strange. But they came to me and they said, you know, our mom loved you, and we know that had she been alive, she would have made an Afghan for your baby. And so they got an Afghan that she had made before she died and came to me, and they said they had all talked about it and wanted me to have it. So I have this beautiful Afghan made by one of my favorite patients that is on the bed of my children.
One of the special things about working at a healthcare center for me is that I get to see often an entire family, not in one visit of course, as I see patients in urgent care or in our primary care or over in pediatrics. I get to know all the family members and kind of at different stages of their health, and I get to learn a lot about them as I learn who their family members are and who their friends are. And so seeing them out in the community also adds to that, and it's kind of the fun thing about family medicine is not just learning about their health conditions, but all the factors of their life and all the things that you can do with that information to perhaps promote their health in ways that aren't traditional medicine. So I see, you know, little babies when they're first coming in for their 2-week well checks, and then I'll go to the nursing home and I'll see that baby's great-great-grandparent. And that's happened, and it's kind of closing the loop. It makes family medicine more rewarding.
It is hard. I will not make any excuses for that. You'll be working sometimes with less staff than you'd like, with less resources than you'd like, but there is no place that is more rewarding. The other thing about working at a health center is it's like working with your family. I remember when my dad passed away. There was no question of whether or not I was going to go back to Pennsylvania. There was no question about taking care of my patients. My colleagues, my health center came together to support me and said, you need to do what you need to do. When I became pregnant with my first child and had to go part-time, there wasn't a question. It was, what's best for your family? What's best for your family is the most important. There's flexibility in a health center. I'm able to balance my life right now because I'm able to be with my patients and be with my family. I've worked with my medical assistant, Isela, for 10 years. My front office has been with me for 9 years. These are women that are dedicated to the patients, to the population. I can't get that other place.
Coming to a healthcare center almost fulfills the reason why a lot of practitioners wanted to practice medicine. One of the advantages, of course, is helping those in the greatest need, and that feels really good, but also not having to manage a lot of aspects of medicine that a lot of us don't like. Being a business person, having to spend a lot of time on that aspect frees you up to really do what you were trained to do, which is practice medicine, but also really focusing on the community health. I think that's what a lot of working for a healthcare center is. It's not solely about managing your patient panel or seeing that patient on that day. It's about thinking big picture and how can my interaction with this one patient or this group of patients affect the whole community. And I also feel like you get to almost do more for patients in a community healthcare center than you would in a private practice. That was one of the reasons I wanted to join a community healthcare center too, is sometimes it's not simple or easy to get specialty access, and or patients just don't want to go or they can't go to specialists. And so you end up doing more for them, and sometimes requires that you learn more. And some people maybe don't want to do that in their career, but that's what I think is fun about medicine. The more you can learn, it's good for you, it's good for the patients, and it makes you a better practitioner.
At the end of the day, yes, I'm tired, but I'm happy, and I know that I've made a difference.